Hi, everybody. Thanks again for joining the MGH Cancer Center Zoomcast series. We have another nursing special tonight. This is just a terrific group of nurse leaders in our cancer center, and we'll get right to it, starting with our wonderful leader in the ambulatory setting, Erika Rosato, who runs the entire ambulatory nursing operation for the cancer center, and we're just incredibly lucky to have her be one of our leaders. So Erika, why don't you introduce everybody for us?
Sure, thanks, Dave. So our first person is Hannah Lyons. She is the Nurse Director of Research. Then we have Bev Hudson, who is our Manager of our Access Nurses, followed by Mary Fay, Nurse Director in Waltham, and Sandra Areias, our Nurse Director in Danvers.
Terrific. Well, welcome everybody. I'm going to start off with Bev Hudson, and the first question for everybody, we'll go around and ask everyone is, how has this COVID crisis changed what you do in your units from a day-to-day basis? And Bev, I know you guys have done something incredibly special. Why don't you give us an overview of what happened with this COVID crisis and what you and some of your access nurse team did?
Sure. I think first, just a brief introduction to what access nurses even do. Okay. So we're the face of the cancer center to all new patient referrals. So we're responsible for setting up all new patients, talking to the referral source, the patient, the daughter, whoever's calling us, getting the patient to the right team, the right day, the right doctors, and also making sure we have all the info for that first visit so they leave with a plan. And every access nurse works in a particular disease group. So when COVID hit, I got a call from HR wondering if we could help. And unfortunately, our new patient volume had gone down a bit for many different reasons. Mainly patients weren't getting their diagnostic testing done to find out they even had cancer. And of course, the fear of coming into Boston and being exposed to COVID. So we all rallied together, and and I'll call us seasoned nurses because we're a bit on the seasoned side. And none of us have been bedside clinical nurses, although we're experts in our disease groups. We're not bedside clinical nurses, and we haven't been for quite some time. But we all got together, we made a schedule. We started, I went first to the RIC in the Lunder, I didn't even know what RIC stood for. It's Respiratory Illness Clinic. And so we quickly figured that out, and we made a schedule, and we've been going for 2 months. We end up going to Chelsea after that first day in London. We go for 2 months. We've gone every single day, 2 access nurses per day. And we do everything from swabbing to the hexapod, to the triage nurse, to the pod nurse. We do it all. And I think one thing I said to one of the doctors I work with, Dr. Hong, I said, well, I figured one thing out, I still got it. So
you never lost it, Bev. Come on, you never lost it. I've been working with you for 20 years, I think.
20 plus years, yeah.
That's great. Well, you guys have done yeoman work in Chelsea, and we all thank you at Mass General for doing it and for serving over in the respiratory clinics. I think it's been a wonderful thing of MGH reaching out to the community to do good work.
Thank you. I think one of the best things, though, just let me say, we met all the PCPs that refer to us all the time. So that was great because we worked with 3 PCPs from all over the, North End, Chelsea, wherever. And it was really fun to meet the doctors that refer their patients to us all the time. So it was good. It's been good.
Terrific. All right, Hannah, how has COVID changed your world?
So with COVID and the response that we as Mass General made in preparation to care for COVID patients, we decreased our research activity. And research nurses are very important and play a key role in coordinating patients' participation in clinical trials or research studies. And our task during this crisis was to make sure that we maintained the safety of our patients who were participating in clinical trials. And in order to do that, we had to make a lot of changes in our everyday practice. For example, we had to coordinate first that the physicians would be able to get access to lab values and images like CAT scans and things like that in the local community, make sure that those results were brought in so the physician could review it. And then many of our physician visits or provider visits with nurse practitioners or physicians happened virtually or through telemedicine. And so the nurses would then send any oral study drugs out to the patient. So there was a lot of coordination, and it resulted, I think, in some improvements in teamwork amongst the group and across all of us and the different groups that we represent, which was exciting. We were able to ensure that patients who really needed it did continue to have access to life-saving treatments through clinical trials when there was not another alternative available to them. And that was really important to us. So although we didn't accrue to or enroll in clinical trials at the same rate, we did continue through the whole crisis to enroll, and kudos to all the team members who made that happen.
So just for folks out in the audience to understand, Hannah's team is one of the busiest clinical trial programs in the country. You put about 1,200 people a year on clinical trials. And so, and it's one of the busiest, what we call phase 1 programs in the country. So that's the first in human, the highest risk clinical trials, if you will. And you guys have just been tremendous at standing up that clinic for the folks who are on these clinical trials while the COVID crisis is ongoing, and doing it in a manner that's incredibly safe and effective. So thank you to you and all your team. Mary, how about you? How did your world change in COVID?
As you know, we are not actively treating COVID patients out here, but we needed to, I sort of likened us to the outfield as far as, creating an environment where the main campus could send patients that either were afraid to come on to the main campus, that needed labs done remotely without coming on to the main campus. So our COVID-free zone has been incredibly reassuring, particularly to our cancer center patients, that we wanted to kind of streamline and sort of keep out of the really, really heavy COVID areas. So feedback from patients has been phenomenal. I think it's also, we've been trying to grow this program since out here in Waltham. It inadvertently became a fast and wonderful opportunity to de-link those patients out here. As you know, I have not said no to anybody that's wanted to come out here. And we have taken it on, and the team, we've shifted our days, we've shifted our hours. The nurses are doing 12s. We've just adapted as much as we could to try to, in a backdoor way, kind of help our teams up on the front lines keep doing what they need to do.
And you've done phenomenal. The feedback I'm getting is just tremendous. People love it out at Waltham. The convenience.
Free parking.
Yeah, the parking, everything has been great. And the connectivity, and we'll get to this in the next question when we come around again, but I think one of the biggest things that's going to stay is the distributed nature of our cancer center. People are going to be getting their care all over. Sandra, how about you? Tell us how your world changed.
Yeah, so here in Danvers, we're uniquely like an all-in-one cancer center. So we have medical oncology practice, infusion, as well as radiation oncology, all within the same center. So initially, we did a lot of work to try to minimize the average number of patients within the center at any one time to help to ensure part of that patient safety piece of things. So we did do a lot of delinking of patient appointments. We're transitioned a lot of appropriate visits to virtual care, and also made connections and bridges to area labs so that patients didn't necessarily need to come into the center for that as well. But again, to Mary's point, bridging those communications and those relationships with the Boston area for patients who live on the North Shore has really been impactful here in Danvers. Many of our patients, like to stay on the local side, so here in Danvers, but also have the expertise of being able to keep that connection to the great Mass General providers.
Yeah, it's terrific. just like Waltham, I think Danvers has been a jewel in the MGH network, and the job that you've been doing in this COVID crisis is really phenomenal. So let's switch now to, as the numbers come down, we're seeing the daily numbers at Mass General coming down, and it looks like we're going to get back to a new normal. I don't think it's going to be the same though. And one of the things that is changing dramatically is the shift to virtual visits and the shift to distributing our patients throughout the entire network. I'll give you an example. When I see a patient now and we're done at the end of the visit and I have to schedule a port and then chemo and labs and maybe more imaging, all of that happens throughout the entire network. I've had patients get a port in one place, chemo in another place, imaging in another place, and it's really dramatically changed the way people think about how to get their care at the MGH Cancer Center. So for you guys, and let's go in the opposite direction, let's go back to Sandra. What do you think is going to be the new normal? What's here to stay, and what are you looking forward to as an opportunity to change for the better?
Well, I think that one of our biggest opportunities is to continue to bridge relationships with other Mass General centers and with other area locations that we can leverage some of these ancillary services, whether it's, you know, imaging, like you said, imaging, interventional radiology, lab work, anything like that, that will allow us to really plateau our patient volume throughout the day and really be able to offer patients either better times or more convenient times for their treatments, because we're not trying to cram them all in the middle of the day. So to me, that's the most exciting part, is to be able to bridge those relationships, particularly for myself, because I am still fairly new to Mass General. So it's been, if anything's exciting during this time frame, I think it's the bridging of those relationships, really.
Yeah, I mean, as the patients all know, the 9 a.m. to 2 p.m. crunch is crazy. And we understand it. We get it. People have lives. They have to get home and pick up kids or pick up spouses and make dinners and all sorts of different things that need to happen at home. And so that 9 a.m. to 2 p.m. crunch is known throughout the cancer world as a crazy time in almost every cancer center across the country. So I think you're absolutely right. That opportunity is there, and it's going to change now. Mary, how about you? What is the opportunity?
I agree that I think the teamwork and the collaboration has been probably the most uplifting. If you have to highlight the positives of this pandemic nightmare, I think the humor and the candor and the humanity in these Zoom meetings that has been coming out has been also very encouraging. So absolutely, the MGH as a whole feels so much smaller as we've sort of unified as nursing directors, and in all these Zoom meetings, it's just getting to know each other in this manner has been encouraging, helpful, inspiring, and yeah, it's absolutely, I hope that will continue. I'm certain it will.
Hannah, and how about research? How's that going to change? What opportunity are you looking forward to?
Well, I'm very excited. I've had the privilege of working in Danvers at the Mass General North Shore Cancer Center for the last 7 years almost, before coming back into Boston, having been in Boston before that. And so I'm very excited about exploring the potential of bringing clinical trials not only to Danvers, but Waltham, Newton Wellesley. We have programs at Newton Wellesley and Danvers, and expanding on that. I think there's a great team in both those locations. I think we know how to work in the community, and we're really excited to explore that further with MGH's support, and working with Mary Fay and Sandra as well.
So do you think in the future that even things like some phase 1 studies might be offered in Danvers or Waltham or Newton Wellesley? Do you think we'll get to that point where more involved the study, that we'll be able to get to a point to offer them in those locations?
I think there's a good possibility. I think there are some steps, and obviously we have to work with Sandra and Mary Fay very closely, because we have to have the infrastructure to support that. However, I think MGH is committed to making sure that people in the community have access to a lot of these novel treatments. And so it will be Really exciting to work on that. And this, what everybody's spoken to, just sort of the realization that there's this expanded footprint for MGH Cancer Center, and the collaboration amongst everyone is going to promote that goal of the Cancer Center to really bring that out. So it's very exciting to me. I'm passionate about it. So
that's awesome. And Bev, how about the new patients? What do you think is going to be different about accessing the Cancer Center in the future, and what opportunity are you looking forward to?
Well, first of all, one opportunity for the staff is exciting. I'm in Danvers right now, sitting not too far from Sandra. So we found that the access nurses do our job completely, perfectly on not being in Mass General proper. So I think that's exciting for staff. We're really looking forward to being remote as much as we can, therefore freeing up some safe space in Boston. And happy to be in Danvers. Thanks, Sandra, for making it possible. But for the patients, I think it's changed a lot. Because Mass General is so well known for the cancer care, we get calls from all over the world, all over the country. And previously, we did not do many virtual, or if any, virtual visits for several reasons. But this has made us realize how easy and great for the patients it is. So I don't know if anyone saw the interview that Dr. Ryan did with Dr. Kadan and Dr. Hong, but every Monday and Tuesday, I send out a big long list. So I'm the one that coordinates that whole multi-clinic that they're doing on Monday and Tuesday. So the doctors, surgeons email me all week long, and then I come here on Monday and send out a list for new patients with particular specific GI cancers. And I don't know, 70 people, I think, get that email. And then they all sit in their respective Zoom locations and opine on these patients from all over the country. So the nurse is actually responsible making sure we have all the scans, all the documents and everything. And then I send out the list to Dr. Hong, he refines it, and off it goes. And then again on Tuesday for a bunch of new patients. So we're still getting to opine on many, many new cancer patients. And I think the big message is we're here, it's safe. If you don't want to come, you may not have to come. We can make it happen for you. Most of those patients that did a virtual new patient visit are going to come and continue their care at Mass General for their follow-up visits. So I think it's exciting. I think we've still seen a lot of new patients from wherever. Doctors are so happy to be able to sit together and offer their opinions regarding surgery or whatnot. It's a real multidisciplinary group. And I think there's even more disciplines opining on these patients' cases than there were in the other forum that we did it in a small room. So I think it's exciting. I think patients should call us because we can now see them virtually and they don't have to drive from wherever or fly from wherever. So yeah, I think it's going to be great.
So let's finish up with a message of gratitude. So in this COVID era, it's been awful for so many folks, but you know, what's been the silver lining and what are you most grateful for? And let me start with Erika, because Erika, we haven't heard from you from the beginning, but what are you most grateful for and what's the biggest lesson, I think, that you're taking away from this crisis?
Right. Well, you know, I spoke a lot at our first meeting, so thank you for giving me a pass this time. But really what I think about is that we still, even through this COVID crisis, we fulfilled our mission. So our mission is research. And Hannah spoke so eloquently about how we have continued research, and that is so important to our core. And then our mission is to help one another. And so you heard Bev and Mary and Sandra talk about how we all aligned ourselves and how we help one another to get through this crisis, and very nimble and, you know, changed upon a dime of making things better for our patients and our staff. And the last thing is, again, Bev talking about like how much our community is important to us and our mission. That is a Mass General way. And for her access nurses to, you know, say 2 days a week, I will go into Chelsea. I've never been there before. And I'm going to do, you know, these checks, you know, the COVID checks on these patients was huge. And that's what makes me so happy about, that's the silver lining, is just seeing people come together for the greater good and understanding it's all about humanity, and that we are a cancer center. We're going to get through this. We are getting through it strong. We're going to come out stronger on the other end. Exactly what they spoke about. We've learned new things about each other and what we can do better. And that's what it's going to be, is we're going to be stronger when we come out of this. And I'm just so proud of this team and all the frontline staff. It's been amazing taking us through this journey.
Sandra, how about you?
So I'm just very grateful for the resiliency of not only our patients, but of our staff. They have, to Erika's point, the amount of changes that have come down since COVID started has just been, sometimes I felt like it was hourly, like more than just daily. And the resiliency and just the willingness to do whatever it took at any moment in time. And, walking down the hallway, I'm like, I have one more thing that we need to get done by the end of the day. And people are like, what do you need? What do you need? I'm here. And just that resiliency and that openness and that just accommodating whatever needed to get done to make sure we're providing quality care, best care possible, and the safest care possible for all of our patients. And then also the resiliency of our patients. They've had to go through a lot of changes too, going through phone screenings, in-person screenings, no visitor policy, all of those things, and just being accepting and understanding that it's not to not be accommodating of them, but it's to ensure the safest place possible for them to receive their care. So just, I think, the overall resiliency of everyone.
Mary, how about you?
I think COVID was a real level playing field for all of us, because none of us have ever gone through anything like this. So I think it created an incredible opportunity for bonding as an entire cancer center. And although it might be a little corny, but I do liken us to, every department was like a patch on a quilt. And I think the cancer center leadership really did a nice job, just kind of, in particularly a lot of credit I give to Erika for pulling the teams together, the ambulatory, the outpatient, the inpatient, did a nice job just kind of threading through, always coming back to us, pulling us in different ways. And together, I think we've made an incredibly strong team.
That's terrific. Hannah, what are you most grateful?
So I think that everybody's spoken to some real strengths that emerged from all of this, and the team building has been incredible. I would also add that we have not lost our empathy, whether it's leaders for the staff or staff for the patients, and staff including providers, everybody from, a housekeeper who gives me a big smile and lets me walk all over his newly cleaned floor. People have been incredible, and that speaks to the resilience. But people have worked really hard to share how they continue to make connections with colleagues and patients, and how difficult that is. And I've really appreciated that openness and that ability to build connections with each other, and trying so hard despite masks and phone calls and virtual visits and things like that.
That's terrific. And Bev, what are you grateful for?
I think I'm grateful for actually the opportunity to help in Chelsea. And like I said, meeting those PCPs they're just incredible. And the medical assistants who all are fluent in Spanish, who could help us with the patients. I think working with some new nurses that I had never met before, I think it was great for our team to do that. And I'm also very grateful for the fact that we still were able to take care of our new cancer patients virtually. And they were so thankful for that, because they did not want to come into the hospital. So I'm glad that we found a new way to see new patients, and I think we all did a great job.
Well, I'm grateful for the people that I work with, and I'm grateful that we have incredible nurses, and it all starts with the nursing leadership, which you guys are, and the job that you've done in the last few months has just been absolutely terrific. So thanks to everybody, and have a wonderful rest of the week.
Thank you.
Thank you.